Hello, this is a video for people who are interested in training in existential therapy. It will go through some of the facts related to existential therapy, but it will not look at the existential philosophers or the existential practitioners. So what is existential therapy? It is first and foremost a philosophical approach, and it is concerned to understand people's position in the world. It's about clarifying what it means to be alive. And it is committed to exploring these questions with an open and receptive attitude, not a dogmatic one. The search for truth with an open mind and an attitude of wonder is always the aim, not fitting the client into pre-established categories or interpretations. The idea is that to be human, is to become, to always be in the process of becoming something more that you weren't before. Human nature is therefore always open-ended, flexible, and capable of an enormous range of experiences and transformations. And every person is constantly in that process of becoming something new, something different. You create yourself as you exist. There is no once and for all solid, essential self. No given definition of your personality and abilities. You make it up as you go along. You transform yourself. You become what you want to be. This also means that there is an open-ended, transcultural model of humanity. There are no restrictions on how to categorize or label people. Instead, we always look for the universals that humankind shares and that can be observed transculturally. There is no existential personality theory which divides humanity up into types or parts or reduces you to these individual part components. Instead, we always try to look at the different levels of living and therefore of your experience that you are being confronted with. Some 10 years ago, existential therapists coming together for the first time at the First World Congress in London agreed a worldwide definition, and I will read it to you. Existential therapy is a philosophically informed approach to counseling and psychotherapy. It comprises a richly diverse spectrum of theories and practices. Due partly to its evolving diversity that I was talking about, existential therapy is not easily defined. For instance, some existential therapists do not consider this approach to be a distinct and separate school of counseling and psychotherapy, but rather a kind of attitude, an orientation, a stance towards therapy in general. However, in recent years, existential therapy is increasingly considered to be a distinct approach, and therefore it is important to try and give it some definition that everybody can agree with. It's difficult, though, to formalize all that and to define the heart of existential therapy, because its philosophical practice is always about relations that are happening, ontodynamics, the dynamics of being that are going on in a spontaneous and flexible process. Freedom always comes before any kind of doctrine or dogma in existential thinking. Indeed, due to these core qualities, the attempt to define it may seem contradictory to the very nature of existential therapy. As its core is philosophy, which is the love of wisdom, we are ultimately most united in existential therapy by our commitment to finding wiser ways of being. And as with other therapeutic approaches, existential primarily, though not exclusively, concerns itself with people who are suffering or who are in crisis or both. Some existential therapists intervene in ways intended to alleviate or mitigate such distress wherever possible, and assist individuals to contend with life's inevitable challenges in a more meaningful, fulfilling, authentic, and constructive way. But other existential therapists are less symptom-orientated, less problem-orientated, and are more engaged with clients in a wide-ranging exploration of human existence, without presupposing particular therapeutic goals or outcomes geared toward correcting cognitions or behaviors, or mitigating symptoms, or remedying deficiencies. Nevertheless, despite significant theoretical, ideological, and practical differences, all existential therapists share this particularly philosophically derived worldview, which distinguishes us from most other contemporary psychotherapy practitioners. We explore the human conditions. We propose a supportive and collaborative exploration of our clients' and patients' lives and experiences. We place primary importance on the nature and quality of the here and now in the relationship, but also on the exploration of the relationships between the person and their own contextual lived worlds beyond the consulting room. In keeping with the philosophical foundation, we take the human condition itself to be vital to understanding what's going wrong for a person. Because all the myriad facets, from tragic to wondrous, horrific to beautiful, material to spiritual, always come into the narrative that we consider. We consider all human experience as inseparable from the ground of existence, from being in the world, from practicing being human in your everyday existence. And that is something we inevitably all have to do, continuously, and that we constantly participate in. So existential therapy illuminates the way in which each unique person, within certain inevitable limits and constraining factors, comes to choose, create, and perpetuate his or her own way of being in the world. In both its theoretical orientation and its practical way of working, existential therapy emphasizes and honors this perpetually emerging, unfolding, and the paradoxical nature of human experience. And it brings unquenchable curiosity to what it truly means to be human. Ultimately, it can be said that existential therapy confronts some of the most fundamental and perennial questions regarding human existence, such as, who am I? What is my purpose in life? Am I free or determined? How do I deal with my own mortality? Does my existence have any meaning or significance? And how shall I live my life? This existential work is always based in the method of phenomenology. These are philosophies of existence that stress ultimate concerns, often in dialectical tension with each other, such as freedom of choice, which is opposed to necessity, the quest for meaning or purpose, which is opposed to nihilism and meaninglessness, or triviality, despair, which is opposed to hope, and death, which is always opposed to joy and the desire to live our vitality to the full. Existential therapists use phenomenology in a disciplined way to foreground these ultimate concerns and givens, and to not allow a person's basic experience of being in the world to become deadened or boring, but to illuminate it afresh and to reveal its deeper meanings, so that the person becomes deeply engaged with their existence and gets a sense of being involved with it directly when it had all felt so distant and so aloof. This method of phenomenology always begins by us as therapists setting aside our presuppositions, our assumptions about the world, or even our assumptions about human beings or about therapy. We aim to open up, to be truly available in the work with the other person and explore the other's subjective reality in an objective manner. So there can be many motivations for individuals choosing to engage in that kind of exploration, but it is often sought by people who have found themselves in the throes of an existential crisis, which is a specific circumstance in which they experience a threat to their survival, to their security, to their identity, to the significance of their own being and the way they conceive of that. They often don't know what it means or how they need to go on from there. And they struggle with this threat in physical ways, in social ways, in emotional ways, and in spiritual ways. They have difficulties in making sense of it by themselves. They are in shock, and they are shaken out of their sense of safety and complacency that so many people normally live with. But it's always good when we are forced to question and doubt our most deeply held beliefs, values, and habits. It can just be very helpful to have somebody help you think about it carefully and clearly. Existential therapists believe that it is human existence by its very nature that brings such change and becoming, and that we will inevitably be confronted with these kinds of existential crises or challenges across our entire lifespan. In existential therapy, these disorientating and anxiety-provoking periods of crisis are perceived as a perilous but important passage that a person can be guided through safely, because it's always in those times that the person comes more to life and becomes capable of transformation and growth. This happens in a dialogue where we come together with the person who is suffering in a mutual, collaborative, encouraging and explorative dialogue where we struggle with the realities of human existence as they are experienced for this person who is at the moment going through their existential crisis. Existential therapy places particular emphasis on cultivating a caring, honest, supportive, empathic, yet challenging relationship between client and therapist, so that things can be looked at squarely and reality can be faced instead of being denied. There is an encounter that takes place, and that focuses in first instance on the here and now experiences, feelings, thoughts and interactions within that relationship, but also what is happening in the outside world for the person. It is respectful, compassionate and supportive, but it is always real too. And there will be moments of disagreement or difficulty and conflict between the parties, and we accept those as part of the process instead of interpreting them in some way as caused by the client's symptoms or difficulties. So our phenomenological stance allows us to comprehend and address fully the person's way of being in the world. We take great pains to avoid imposing our own worldview and our own value system upon clients and patients. Existential therapists may sometimes disclose something about it or point out inconsistencies in what clients believe or what they assume is the case. We work with pointing out contradictions and incongruence in somebody's habits and ways of being, but we never impose alternatives. We allow people to explore these new ways for themselves. So it's all about allowing the person to confront self-defeating and destructive ways of being in the world, or ill-informed ways of being in the world. It is about allowing a person to express themselves so fully that it becomes obvious to them where there are problems with their worldview and their perspective, and where it is simplistic, where people are seen in just positive and negative, or healthy and unhealthy. And instead we try to illuminate the whole range of ways of looking at things, to see that it is always a little bit more complex than we might have thought initially, and that there are always many different choices available about how to explore doing things differently or understand things differently, how to affirm and embrace new ways of being yourself. So this is about facilitating a process of liberation. It is about enhancing a person's awareness of inner experiencing, of subjectivity, of the temporal and the transitory, the vital flux of moment-to-moment thoughts, sensations and feelings, but also to look at the inevitable interplay between past and present, and past and present and future and present, and how all of that interacts and how you can learn to play with that. So existential therapists respect the impressive power of the past and the future and directly address these, as they always impact on the person's experience of the present. We look for depth in our work. We do not diagnose superficial ways of being that are so tempting to categorize or attach to the person like an identity. We have this open stance and emphasize relationship and actual experience. We do not aim to give a person a psychopathological definition. We do not give out diagnoses. We help people see how they are struggling in the world and what might be the obstacles to them getting a wider perspective on what it is they're struggling with, and how they might approach things differently and have a wider range to approach things than they have done to date. So we help the person address every disturbing phenomenon and take it deeply seriously. We help them grapple with it rather than immediately try to suppress symptoms or eradicate them. It's about understanding where they come from and how we can mitigate them, or how we can approach the difficulties of life in a more creative and helpful way. So it is exploratory and it is always creative. There is a purposefulness and a directionality about it. But it is always about clarification, elucidation, shining light, understanding, describing, rather than analyzing, explaining, and treating and curing a person's suffering. Suffering is too important to make light of it. It is important to take the person's suffering seriously and understand what the roots of it are. In order to do that, we use Socratic questioning and active listening and reformulating and reflecting and dialoguing all the time, figuring out together what is the better way of describing something, a better way of understanding it, getting closer in all the time to that moment where suddenly all comes clear. Existential therapists often use bits of other therapies that are helpful. Psychoanalytic interpretation sometimes, cognitive behavioral therapy, working towards practicing something, person-centered attitudes of acceptance and empathy and affirmation, somatic work, working with embodiment, Gestalt therapy, which is good at doing the paradoxical work of polarities and bringing those together in a question and answering process. There is incredible technical flexibility because technique is not foregrounded, but it can be used as long as we are philosophically principled and we are humanly available to the other person as fully as we can possibly imagine doing so. It's always deliberate and intentional what we do, and we always seek to illuminate a person's existence and their very personal ways of being. So it is also about practicing and modeling living more deeply, more honestly, more openly, and more comprehensively. It is about educational experiences to some extent. It is about allowing clients to explore their lived experience in ways they haven't dared before, and to learn to be spontaneous about themselves and in their relationships again. And it is about experimenting and exploring and wrestling with profound philosophical, spiritual, and existential questions of all kinds, but also with mundane, everyday questions of how I can do things a little bit differently to make things easier for myself. It's always about engaging in a supportive, exploratory, but challenging process. It's always about coming to terms with what has gone wrong and to take responsibility for the choices you have made and the choices you are now capable of beginning to make. It's all about encouraging the person to choose new ways of being and a new future, new values and new purpose, and to really revolutionize their life as they start to identify much more deeply satisfying and meaningful and authentic ways of being as possible for themselves. We can do existential work in lots of different settings, with individuals, with couples, with groups, with families, in organizations, in clinics, in hospital, in private practice, in the workplace, in the wider social community. Because existential ideas are so much about everyday existence. They are just relevant and practical and adaptable in all these different situations. And they don't impose this psychopathological lens which immediately takes interventions into the domain of medicine, psychiatry, or clinical psychology. We keep it at the level of a philosophical and a personal exploration, and that makes it very relevant to what is happening in most people's lives. There is now a body of evidence of how effective existential work is. Yalom, of course, discovered that existential factors were essential in group work to lead to change and transformation. We also know that Seligman and Wampold and Norcross and Lambert have discovered similarly that using these core qualities and seeking depth in the therapeutic relationship and empathy is predictive of positive outcomes. Existential work takes all of that very seriously, but in addition has these objectives of truly making sense of a person's life and enabling meaning finding. Google says that according to Emmy van Deurzen, that happens to be me, existential therapists should have the following personal qualities. So this would help you wonder whether you could make a good existential therapist and whether you would be good for existential training. You need to be able to do critical thinking. You need to be able to consider what's happening in the world, in your own life, between you and other people, what ideas people are peddling, what's happening in situations, in the news, in your family life, at every level of your existence. And pause and ponder. Ask yourself, is it true? What about it is true? How does it really work? What is this really like? You have to have that critical thinking and that willingness to go figure it out and find appropriate information before judging something. You also have to have a capacity for self-awareness, to reflect on yourself and to enjoy doing that, to, wake up in the morning and wonder what you've dreamt about and what it means, to ask yourself, why am I feeling up and why am I feeling down? What is it in my life that is bringing my strength and my weaknesses out? And what are they? And how can I engage with those and maximize what I'm good at and overcome some of those weaknesses by further thought and training and practice? All of that should already be part of your life. You should have intense curiosity, probably from when you were a child. A genuine sense of curiosity, not just in a selfish way, but just about what the world offers us and what it all means, Why is the sky blue? Why do people treat each other the way they do? How can I learn to make things go better for other people? All of these things should be cause for curiosity. And also an attitude of wonder and awe, which is about enjoying looking at the stars at night and feeling a sense of connection to the cosmos, to the universe. It is about looking at a sunrise or a sunset and feeling transported by it. It's looking at the budding trees in spring or the leaves turning in autumn and getting a deep sense of meaningful connectivity to all of that. But you also have to have the capacity for tolerance, for tolerating anxiety and despair, because they're always part of existence. And if you're in denial of that, how can you ever help people who are going through that experience of anxiety or despair? So you've got to be able to tolerate the difficulties of life and not to seek to just have the good times. That's very important. And you also have to have the creativity to work in your own way and figure out your own personal way of thinking about things. You should never be heavy-handed or cynical or downtrodden, but light and humorous and aware of the tragedy, comedy of existence, the bitter sweetness of life. It's really all about allowing yourself to come to maturity and to not worry about aging, but really look forward to the increase in your wisdom that comes with your maturing years. So existential therapists typically have to be quite mature as individuals, and they have to be able to make room in themselves for opposing views and not panic about it, to welcome contradictory opinions and cultural tensions, feelings and thoughts and experiences that make life interesting, and stay open-minded instead of trying to close it all down. Not clinging to one point of view, but being nimble on your feet and being genuinely curious to explore a range of different perspectives that different people will bring to you, and always learning something new from each of those. It's also about tolerating the tensions that this might bring out in your clients and not be cowed by their slight aggression or their dissatisfaction at times. To be calm and considerate in those situations. So how do we foster this kind of maturity? Well, you can foster it by travel. Finding yourself living in different cultures is particularly helpful. Cross-cultural experience stretches your mind and it stops you assuming you know everything, especially if you've learned to live somewhere where you had to speak a different language and where you've had to question the way you look at everything constantly, and where you've had the humiliating, humbling experience of not knowing so much. A lot of people gain this kind of maturity also by caretaking, especially by raising a family of their own, or looking after animals, or looking after elderly dependents, or looking after disabled people in their family, or doing this as a job. Some have learned this maturity in the teaching profession. Some have learned it running an organization and in leadership positions, discovering that that is also about caretaking. There are many different ways in which you acquire that maturity, and some people never acquire it. It's not about age per se. It is about how you are in the world and what you learn from your experiences, not about the numbers you've clocked up in time. So it is about being immersed in the world and to have seen life and human existence from different angles, in different jobs, maybe different forms of studies, living in different social classes, living with different partners. Basically, having moved about a bit in your life, having lived a little bit and having learned a lot about that living. So it is about reflecting on those experiences rather than just accumulating the experience for the sake of the traveling or the sake of ticking boxes. So maturity comes to the fore when you're asked to take charge of a situation that is difficult. And it will be quite clear who are calm enough to do that and who are able to bring this intensity they've acquired, this calm and peace they've come to a professional situation. To be open-minded and critical in thinking, as I said before, and to still be light-hearted and hopeful and humorous even about the darkest, most tragic situations, and to trust life, that solutions can be found, and to trust human beings that they will find their way through, and to trust fate that it will bring new possibilities on a person's path. Those are all qualities that also come in handy when you're working with somebody who is anxious or depressed or despairing or suicidal. So there is a lot of knowledge and a lot of experience that is needed to become wise enough to be an existential therapist. But in addition to that, you also need to learn lots of things. You need to study both psychology and philosophy, and there is an immense amount of knowledge to be gotten from both those disciplines, but also from other disciplines like psychoanalysis or anthropology or sociology, sometimes from politics as well. So a broad interest in all those spheres of life. And also, I would say, a deep interest in reading literature, novels, watching movies, and being interested reflected in how people find their way through difficult situations in life. So the training will always be aligned with professional body requirements in your particular country. Mostly in the UK and in Europe, people need to do 4 years of training as a psychotherapist post the acquisition of a first degree in a relevant subject. And that 4 years of training will always involve the theory, as I've just described, the practice, so you learn about how different practitioners teach technique or practicing, and then your placement, your internship, where you start practicing this yourself, and your self-reflective work, analyzing how you are in your own existence. So you are your own first client, and it is only when you have arrived at the capacity for self-reflection and understanding, self-understanding and self-love and self-care, even under fire and in difficult conditions, that you will be ready to start working with other human beings as well. Be flexible. Teach yourself to be flexible. Most of the things I've said are about training yourself to be open-minded and flexible and curious and constantly in change, constantly on a path towards something. Be aware that we're all unique. Everybody is an individual, and to reach out to how this particular individual experiences that particular situation is how you become an existential therapist. But of course, you need to have learned how to deal with specific issues, specific obstacles on the road of life, particular dilemmas that clients are struggling with. And you need to have an appropriate way of being open and serious and totally available to the other person in figuring things out. So you learn to work with space and time. You learn to work with all the elements of human existence, and you learn to confront yourself with different opinions and moral evaluations without you proffering further ones. It is about resisting the temptation to change your client, but allow your client to find their opportunities to learn and to change naturally in that process. We don't interfere. We enable and we facilitate. We do not teach or preach, but we allow the person to thrive and to evolve naturally in their life and to find their own path. And we do this always with a large amount of intensity and depth. It's always about facing up to the dark side of life, because you've got to be able to go deep into the roots of a person's problems, and you've got to not be afraid of meeting all of these challenges, because each of the challenges are grist for the mill. They're all part of human learning. Therapists model this, and they show this constant awareness of how we come to things from a particular bias, a particular standpoint, a particular worldview, and how we can challenge and question that too. We discover themes in what people bring us, and we start to recognize those more and more, the myth and the stories, the beliefs and the fantasies that people come with. The narrative work is always very important. We challenge people's assumptions and figure out how those stop them in their tracks. We help them reveal those and throw new light on dilemmas that felt very stuck and one-sided. We help people recognize vicious circles and turn them gradually into spiraling virtuous circles that are no longer obstructive but facilitative. We help people question dark meanings and find new meanings, meanings that make more sense and that give life more purpose and more deeper significance. We help people question their values and seeing how their values mess them up and how they often take them for granted or are hardly aware of them. Becoming clear about your values allows you to renew them too and find more satisfying direction and new inspiring purpose in your life. But this always requires you to challenge your self-deceptions, and this is one of the very hard things to do when you work with people as an existential therapist. To allow the destructive forces of crises to reveal the self-deceptions that the person has lived with, but not in such a way that it makes the crisis worse, but in such a way that it allows the person to feel liberated in the process of going forward and beyond things that had been stuck and obstructive in their lives. And this brings out existential anxiety, and you've got to have worked with your own existential anxiety, my friend, if you're going to be an existential therapist, and have peace with your anxiety, because it's a sign of life. It's the sine qua non of your awareness and your full aliveness, and to truly learn to stand within this aliveness and make optimal use of anxiety is something you need to learn to do as an existential therapist too. And to work with existential guilt, to figure out that people always feel indebted to life in some way, that they know they're guilty in some ways of not having done the right things, not having done enough, not having been good enough or hardworking enough or well enough aware of what matters or done right by the other people in their lives. And to bring these frustrations and hidden secrets out in a person's life, and to see how important existential guilt is in guiding a person towards freedom and self-confidence, as we know we can start relying on ourselves to do things for real rather than only pretend in life. Because that is how we learn to make choices that have consequences that we can live with and oversee and stand by, living responsibly in a new way with our own choices. And not to make them lightly, but make them in a considered way. And not to wallow in a sense of our suffering, but find ways to alleviate our suffering by also alleviating the suffering of other human beings very often. It is also about discovering our capacity for being courageous, not just for ourselves, but with and for others too. And it is always about understanding what is really the miracle of the paradox, which is that both sides are always important, and that if you make room for contradictions and conflicts in life, you expand the space you have, the time you have, the facility you have, the freedom you have to live to the full. Don't be afraid of necessities, reality, doubts. Don't be afraid of life, but welcome it into your heart. At all levels of life, at all levels of the fourfold world, at the physical level of you being in a relationship to your body, at the social level of being in relationships and connectivity with all these other people, and how? At a personal level of how you create your inner world, and at a spiritual level of how you put it all together and make sense and meaning in your life. And in doing that, you can use your dreams and your fantasies, because all of those and the stories you tell show you the landscape and show you the pathways through the landscape that you can go in your own life, and that you can allow your client to discover for themselves too. Never be afraid of questions. Learn to question life. Learn to question each other. Learn to question society. Learn to question political statements. Learn to question your own life choices. Learn to question philosophy. Learn to question. Learn to see the questions in your life, and the answers will come flying towards you. Learning to question is part of learning to become a good existential therapies, as is working with emotions, which I've often spoken about. Tuning in to your moods, understanding the meaning of each and every one of your own emotions will lead to you being able to do this work with your clients. Whether it's love or joy or pride or jealousy or anger or sadness or upset or fear or anxiety, it makes no difference. Every emotion matters, and every emotion leads towards purpose and value and greater understanding of how things work for the person. And then the landscape of a person's beliefs also comes into view, because light is thrown on the ways in which a person is making judgments about the world. Working with beliefs in a respectful way is one of the hardest and most important things existential therapists do. It takes a long time to learn to recognize your own beliefs and to question them and think about them and explore other beliefs, and to begin to be flexible about it. It takes a long time to work with people of many different backgrounds and beliefs, and to be genuinely available to them in their exploration of what they believe and what it means. Working with a person's talents and abilities and their assets, the hidden possibilities in their lives, is always gratifying, but it should not come before you've done some of the other work. So, attending to the strength in a person is always commensurate with attending to their vulnerability and their weakness too. Both of these matter, and developing possibilities in a person's life that are lying fallow is a wonderful thing to do. It's usually a real gift to the person when they rediscover that. And it often comes out of working with memories and recollections of times in life when things did go well, or when something new was discovered, or maybe something went well for a bit and then it went wrong. So how could it have gone better? And how could you have developed and evolved in a different way? This retracing of past stories is always very fertile ground as well. And all of these different strands of what we've been talking about lead together towards the process of transformation, which is only just the natural process of transformation that everybody goes through. But we enable it, we help it, we make it work better than the very stilting, slow progress and transformation that people make without that kind of support, without that kind of new understanding about who they are, where they find themselves, and how they might want to vary the way they live and discover new ways of being. And now we come full circle back. The maturation and wisdom that you aspire to in becoming an existential therapist, and that you will find through practicing your profession carefully, methodically, and with dedication and persistence and patience, that maturation and wisdom, my friend, eventually is also what you seek to transmit to every one of your clients, because it is what makes life so much more worth living. To discover that life is a process of never-ending change and transformation is exhilarating. To discover that we can wend our way around this change and transformation and make it work for us instead of constantly feeling done down by it is the most wonderful discovery a person can make. To discover that you can do this for yourself, and that it isn't about curing your symptoms, but it is about assuming your life to the full for the very first time ever. That is nothing short of miraculous, my friend. It leads to an immersive process and to the discovery of your existential courage as you make your way into the woods of life where so many things happen. And you will discover that despite the fact that you may have lived through a harsh winter in your life that may have lasted for several years or decades, if you are willing to keep going and to practice your courage and to reflect on your experience, life will always rally round and it will always reaffirm itself, because that is the miracle of life, that it takes care of itself. And if we serve life and we align to life, then it always goes in the right direction. Here is a short bibliography of introductory books that you can take a picture of. And here are some of my own books if you would like to read my particular take on existential therapy. I hope this helps you in making decisions about whether you want to train as an existential therapist and whether existential therapy is also the right approach for you as a client, my friend. You can find me as always, on social media, on YouTube, on Facebook, on Twitter, on Blue Sky, on LinkedIn. Just put in my name and you will find it, really. Take care and read a few books about existential therapy instead of making my words all you know about it. Take care.